This is Midday Mobile with Sean Sullivan on FM Talk 106.5.
Welcome back to Midday Mobile and time for a checkup. Our guest, Dr. William Billett, psychiatrist with AltaPointe Health. Thanks for being here.
Well, I appreciate the opportunity to speak with you.
You know, we've had these conversations over the last months here about mental health. This conversation's a national conversation as well as one that's probably had around kitchen tables all over town.
And an important one as well. It always was important, but the numbers for people with depression and anxiety since the pandemic are trending upward.
Those numbers, yeah, like you said, even I, who's not, at your point, as a person in that world, I see those numbers going up. The statistics come out, whether we're talking about different groups, they talk about kids, they talk about adults, old people, it's across the board.
Mental illness is a common problem in our society, both worldwide and nationally here in the United States. For example, 300 million people in this world suffer from depression. Wow. And probably about 40 or 50 million of those people in this country. At some point in their life, probably 20 million people will have a severe depression that interferes with their functioning and their daily lives.
So, I mean, we're talking about numbers, and I mean, you just take all the biggest cities in the United States and add them together, and that's that number you rolled out for people in the United States suffering from depression, mental illness.
The numbers for people with anxiety are similar, and another really significant corollary to that people don't think about are the indirect costs associated with it, billions and billions of dollars. So we're talking about the GNP of small South American countries.
Yeah, and those are manifest through those people who are suffering that mental illness. That that they're not producing at a level, or
well, many don't seek treatment or have no access to treatment, and so, for example, 50 or 60% of those 20 million people with severe depression might go throughout their life without actually getting treatment. And a proportion of those people don't have access to the medication that might treat their problem.
How many times in your career have you had this eureka moment? Because you're talking about somebody who's chronic, suffering the severe depression. Maybe they don't know what it's like not to have it. You know, like it becomes the normal.
There's many people who begin their early life with depression and have the symptoms throughout. And just as you say, it's really an awakening for them to receive treatment and have a good result and remission of their symptoms.
That's got to be
their life is much different. That's
got to be great to meet with to be there in that process and see that.
Yeah, it's very rewarding.
I imagine. We talked about the number of people with mental illness. Then people ask these questions. This comes up. Listen, the news stories come up that this happened and somebody who had mental illness was associated with that. So are people living with mental illness, are they violent? Are they dangerous?
Well, that's one of the stigmas that's attached to mental illness. Actually, if you look at statistics for the violent crimes committed in the United States alone, less than one, maybe as high as 5% of those are perpetrated by people with mental illness. And usually that's someone who has a severe mental illness that, like psychosis, that goes off of their medication. If you look at statistics, most of the people with mental illness don't commit violent crimes. And of course, when someone does commit a violent crime and the media
we report that. It'll come up that this person.
Then everyone associate who has a potentially a mental illness is afraid to seek treatment because they don't want that stigma attached to them.
But I mean, Dr. Billett, by the stats you're giving me, it's actually people with mental illness would be less likely than the general population.
Well, if you look at the number of violent crimes committed in this country, if you wanted to really associate them with something, you would probably look at substance abuse, which is also something people can seek treatment for.
If we're talking about this beyond there, how about seeking people self-medicating, those kind of things? But that doesn't give them the relief you talked about, that kind of breaking free from it.
Another stigma attached with mental illness that is related to your question, a belief that mental illness is a weakness, that that somehow if I get depression, it's just because I have a weak mind. And we know there's a science underlying psychiatric illness. There are neurobiological, neurochemical reasons and genetic vulnerabilities that explain a likelihood for getting an illness like depression. And I think that education is the best tool for fighting that stigma. Both patients and families, if they understand that this is no different than diabetes or high cholesterol, and that there are treatments for these problems, then they're more accepting of the treatment.
And it sounds like as well, we on the outside of those families or those individuals need to understand what you're talking about as well. These folks are treating just the same way you would treat any other problem, any kind of illness. You treat this with medicine, that person is better, and they do hold jobs and families and do everything else.
It's also very important to understand that psychiatric illness is associated with medical illness.
Really,
people with psychiatric problems and severe mental illness decades are shaved off their life because they're more likely to get illnesses like medical illnesses like diabetes and heart attacks and strokes.
So there's some kind of correlation.
So it's very important for people to understand and accept treatment for all of their problems if they want good outcomes for their health problems.
Well, I mean, so it's incumbent upon all of us then to make an accepting where people feel like, it's okay. I mean, once again, if I had diabetes, I wouldn't have any issue going to the doctor and figuring out how we're going to solve this, insulin or whatever it is.
Absolutely.
Same thing on the mental health side, you're saying.
Absolutely.
So people can address this. You've seen it. You've had these epiphany moments where somebody has turned their world around. That's pretty fantastic. I'm sure there's people you're talking to right now. They go, how do I do this? What's the first step? Who's here to help me? Kind of walk us through that.
Well, there's many resources available to people who have mental illness. The internet, there's websites like the National Association of Mental Illness. They have published resources, the National Institute of Mental Health. You can go to your doctor, your primary care physician. If he can't treat it, he can refer you to a psychiatrist and to therapists and counselors. Also, my organization, AltaPointe Health, has a very excellent central access to care. There's trained individuals who can point you in the correct direction, get you the treatment that you need for the problem that you have.
All right. So somebody listening to that, they want to come see y'all at AltaPointe or just maybe assess their condition. How do they get in touch with you?
Well, the access to care is telephone number is 251-450-2211.
Okay.
And you can call that number. There'll be an individual, a receptionist who can take your information and gather some data about your problem and point you in the right direction for treatment.
Hey, thank you for what you're doing for our community. Thank you for caring about these folks so much.
It's my pleasure to be here and educate everybody about services that are available.
I think we all got the education. Dr. Billett, I appreciate it. We'll see you soon.
Take care.